Vanakkam everyone. Good morning everyone. Dr.Agarwal Kan Hospital massive expansion program start ஆகுது. இப்போ நம்ம கிட்ட இங்க 155 eye hospitals இருக்கு. That is including India and Africa. We are in about 10 countries. Our expansion is going to be now to touch 300 eye hospitals in the next 2 to 3 years. That is the main thing which I wanted to talk about. So, we are now 155 eye hospitals in 10 countries and we will be touching 300 hospitals in a massive expansion program. Now, for this, நம்ம கிட்ட fundraise last year TPG Texas Pacific Group, which is the top private equity player, and Temasek, which is the sovereign fund of government of Singapore, gave us 1050 crores. 1050 crores கொடுத்துன்னு இப்போதான். Again now they have given us 664 crores. So actually within a span of 1 year, we have got an investment of about more than 1700 crores plus, nearly, from TPG and Temasek, from two people. They are very big private equity investors. Plus we add to this, we have internal accruals. So we will be pumping in more than 1200 crores now to touch 300 hospitals. நம்ம main என்ன இருக்குங்க, தமிழ்நாடுல இப்போ நம்ம கிட்ட we have about 40 plus centers, 40 hospitals in Tamil Nadu alone. We will be opening 10 more in new locations. Also, Maharashtra we have opened a new corporate office. When any of you go to Bombay, please come and visit it in BKC area. புது corporate office இருக்காங்க. இப்போ நம்ம கிட்ட மகாராஷ்டிரால 20 eye hospitals இருக்கு. We have got 20 hospitals. 10 are in Bombay alone. And இப்போ நம்ம growth இப்படி இருக்கு, ரெண்டு methods இருக்கு. One is we can start from fresh greenfield project start ஆகுது. But we are now going ahead with these Bombay, Maharashtra, brownfield, that means we are acquiring hospitals. So in one shot, we are buying out many hospitals. So the growth is much faster. One more thing I want to tell you all is 3 geographical areas, Delhi, NCR and UP, namakita illange, we are opening into these 3 big areas. And you can see UP huge, Delhi is huge, NCR is huge. Africa le namakita eppo irukku 16 hospitals, 16. We are opening in new countries like Nigeria and Democratic Republic of Congo, DRC. We will be opening 30-40 hospitals in the next 2-3 years in Africa also. Africa. இப்போ நமக்கு 10 countries இருக்கு. We will be touching 12 countries because I said we will be adding Nigeria and Democratic Republic of Congo. One more thing which I want to tell you all is, இப்போ நம்ம இங்க தமிழ்நாடுல we are opening eye clinics, small centers, tier 3 cities, even in small locations like Chengalpet நம்ம open ஆனது. இப்போ நம்ம 12 eye clinics open ஆகுது. ஆம்பூர்ல இருக்கு, we are opening in Karur, கௌடிவாக்கம்ல இருக்கு, செங்கல்பேட்ல இருக்கு, எல்லா பிளேசஸ்ல நம்ம eye clinics. இதுல என்ன இருக்கு, we are going to give free examination for anybody, and you can mention this in eye clinics, all things will be totally free. We were allowing people to walk into eye clinics, examination, everything free. If they need surgery, யாருக்கு இந்த surgery வேணும், கிட்ட இங்க ஹாஸ்பிடல் இருக்கு அகர்வால் அங்க போயிட்டு ஆபரேஷன் பண்ணலாம். But all the examination, everything is totally free in the eye clinics. இப்போ நம்ம கிட்ட 12 eye clinic இருக்கு. We are going to open 40-50 eye clinics by this year end. So as in all, நம்ம ஐடியா என்ன இருக்கு, to show, இப்போ இந்தியால நீங்க பார்க்கலாம், there is about 1.2 crore blind. இதுல 55% போரபத்தி இருக்கு. இப்போ நம்ம பார்க்கலாம் இதுல இவ்ளோ patients blind இருக்கு. So obviously if you have more centers, the eradication of blindness is always faster. One more thing I say, with all this, we are also doing latest treatment, pinhole surgery. இப்போ யார்கிட்ட ஃப்ரண்ட் விண்டோ கார்னியா இருக்க டேமேஜ் இருக்கு, நம்ம டிரான்ஸ்பிளான்ட் பண்றோம். யார் சத்து போடுற கண் எடுத்துட்டு இங்க போடணும், அது நம்ம சொல்றது ஐ டிரான்ஸ்பிளான்டேஷன். இப்போ நம்ம புது ட்ரீட்மெண்ட் இருக்க பின்ஹோல் சர்ஜரி, நம்ம கண்ணு ஒரு பின்ஹோல் மாதிரி கிரியேட் ஃபார்ம் ஆகுது, அப்புறம் கண் டிரான்ஸ்பிளான்ட் வானா அது கேசஸ்ல. ஸோ இன் மெனி கேசஸ் விச் may need eye transplantation today, because of pinhole surgery, will not need eye transplantation. And please understand, this is a big benefit because it's not only in India, even in Africa we are doing pinhole surgery, and these patients can benefit from that. So again, to tell you in a summary, basically what I want to tell, Allah perkitta enna solnom, number one, Agarwal Kan Hospital is going massive expansion to touch 300 eye hospitals in the next 2 years time. Second thing is, TPG and Temasek gave us 1050 crores just now, 1 year back, and again now they are giving us another 664 crores they've already given us. With all this, we are going to invest another 1200 crores to create these 300 hospitals. We are also opening up Agarwal eye clinics. Na solne Amburle, Karurle, in many places நம்ம Agarwal eye clinic open ஆறுது. Africa we are expanding further and opening into new countries like Nigeria and Democratic Republic of Congo. இருக்கு நம்ம முன்ன ஒரு ஹாஸ்பிடல் இப்போ 4 இருக்கு, மொரிஷியஸ்ல இப்போ 3 இருக்கு, மொசாம்பிக்ல இப்போ 2 இருக்கு. So we are going to deep dive into these countries so that we can expand further. Okay,
firstly would like to take a moment to thank all of you for your support, and everybody from Chennai, because we have grown from one hospital to 150 hospitals and now are the largest player in many of these states. Mumbai we have 10 hospitals, Maharashtra we have 20 hospitals now, so we have a total NCR and UP. It's a great thing for a Chennai based firm to get investments of such size from across big investors in USA and from Singapore. Whatever investments will come, we will be using that to expand Agarwal Eye Hospital network across the rest of the country. We're looking at expanding more into Mumbai, into Delhi, into UP, into Punjab, some of these regions. Along with this, we're also looking at setting up 100 clinics like what he was talking about. Look at, right now we have, as an Agarwal Eye Hospital group, we have over 400 to 500 doctors and over 4,000, 5,000 employees. With this expansion, we are looking at catering to at least 10,000 to 12,000 employees, providing employment opportunities, 10,000 to 12,000 people, and over 1,000 doctors. Along with this, a lot of other opportunities we will be able to provide to a lot of people. We are looking at setting up big hospitals in most of the major cities, along with smaller hospitals in tier 2, tier 3 markets. So it's not like we're only looking at Chennai or Bangalore or Hyderabad. Tamil Nadu Pathina we have in Tirunelveli, we have in Nagarkoil, we have in Madurai, we have in Trichy, all these kind of places. Similar strategy we are following in other states as well. In Karnataka, it's not just Bangalore. We have in Hubli, in Dharwad, in all these smaller markets. That is the way we are looking at expanding, and hopefully we should get to about 300 hospitals in the next 2 to 3 years. From there, the long-term plan is to get to 500 hospitals across the rest of the country. If you see our close neighbor, Kaveri Hospital also recently got a fundraise done. Apollo Hospital is obviously doing very well. Another player from here, Maxivision, also got funding done. So lot of support is coming in terms of healthcare investments into Tamil Nadu based companies and India per se as a region, which just shows that the story for the next 5 to 10 years lies with India. Indian economy is growing really well. Along with that, a lot of investments are coming in from a lot of global investors who see India to be the next big opportunity. So, once again, want to thank you all for coming here and listening to our expansion plans.
One more thing I want to tell. Today, every day, or nalle, number 10,000 patients in a single day we are seeing, plus, across the board. Approximately 10-15,000 patients every single day. நம்ம பார்க்கலாம், that means one patient comes with at least 2 attendants. So every single day, at least 50,000 people are walking into some Agarwal hospital or not. This number will actually double. So effectively in the next 2 years time, we will be touching 1 lakh people walking into Agarwal hospital, some center or the other, every single day, which is going to be huge numbers. That is what. So with all this number expansion பண்றது, high tech quality care கொடுக்கிறது. So we are trying to make the whole system in eye care into an organized sector. So the advantage when we are buying out other hospitals is we are getting ready-made, the doctor, the team, the equipment, everything is ready-made available there. That is why Bombay le nam open another, better to acquire. Punjab le po namakita 7 hospitals irukku, Jammu le irukku, and that is the main aim of the group. I want to thank everyone for coming here because we thought this is a very, very big expansion project and we wanted to share with all of you. Thank you so much, everyone. Both ways, but let me answer your simple question. Ipo nama Madurai, small example, we acquired a hospital in Madurai. If you notice, Dr. Srinivasan irke, within things, the numbers have doubled. Every day, in Madurai alone, we are seeing 1,000 patients in one single day. Every day. And we have got 3 hospitals in Madurai. 2 are greenfield, 1 is acquired. So we have both the combinations working, acquired and greenfield. Suppose number Tamil Nadu, we can go greenfield. But suppose I am going into Bombay, it is better to acquire because it's faster and immediate. We don't have tie-up with the hospitals right now because in Africa, everywhere, we are going fully on our own. So we are not taking anything, but time will tell if needed, we need. At present, we don't need because to be honest, our brand is very strong, our doctors are very strong, so we are able to expand into Africa also fully on our own. Good question. So we will be looking at that in the next 2 years' time. Okay? So we are definitely looking at that. Right now, we have got enough funds for the growth, as you can see, because TPG and Temasek have already did, but that goes without saying it will happen.
But next 2 to 3 years we are planning.
It will happen.
We are planning that.
It definitely happen. Now solra. Simple question is Porapati irukku. Number India la neenga paakala approximately let's say 1.8 1.2 to 1.5 crore blind. Idile 55% Porapati irukku. Number India la enna problem enna irukku? 2 problems. One, sunlight. Second, food. Because of the food habits being bad and sunlight being a lot, number pore normally it happens at about 50 years. Suppose number America le paakren, pore will start at about 70 years. In India we get earlier cataract. So the statistics are 55% of let's say even 2 crores, approximately 1 crore blind because of cataract. Only because of cataract now. Pore pati solra. If a male female both are equal. Okay, right eye, left eye. If it happens in one eye, it will happen in the other eye. It is not that it happens in one eye unless somebody punches you. But one advantage in there is that if a bomb blast another, let's say, yes, adipatachi. If we lens port mudile. If we cameras in here, suppose we lens edutite paak mudile. Number is a glued lens port pudu technology. Number gum port ulle lens fix pandrathu. So with that, even those people with bomb blast will be able to see. So CM scheme irukku. Ipo yaarkitta retina damage irukku. I'm small example. Ninga diabetes patti solren. Suppose diabetes patti kannla ratham irukku. Okay, all they need to do is come to the hospital, no charges at all. All through CM scheme they can get treated totally. So CM scheme which our honorable chief minister is doing is excellent work which our chief minister is doing. Idella advantage irukku idella. You are saying something? We are doing it. We not only go to preventive measures, what we do is, one is we go to corporates. So let's say, if ningala journalist irukku, continuously ninga pair immediately now deadline, okay, deadline, you will be straining continuously. This is the reality, correct? No, na enna solren, number poitu office la poitu solren, cool down, nothing will happen. 45 minutes you work, 5 minutes take a break, do palming, again back to work. You'll be all right. Same thing நம்ம ஸ்கூல்ஸ் போறது. ஸ்கூல்ஸ்ல இப்போ நீங்க பார்க்கற குழந்தைல இப்போ இதேதான் 24/7 டிக் படிக்கல சும்மா டிவி சீரியல் பார்க்கறது இல்ல. Correct? No? So you cannot stop it. Please understand, my grandson also watches. I cannot stop him. Okay? But all we can do is educate them. Dryness varno illa kannala. So take a break after 45 minutes. Take rest, again start again. That's what we can do. So we are doing the screening to prevent. Prevention is better than cure. Most important is all of you, because when you give education to outsiders, ki eat well, it helps. Otherwise they will go berserk in eating. Ipo mithai saapadradhu, ide saapadradhu, control illa, sugar illa. We already got 2 hospitals in Bengal. We have just opened the 3rd hospital in Calcutta also. So we have got 3 hospitals already in Calcutta alone.
And Odisha we have 2 hospitals.
ஒரிசால நம்ம கிட்ட 2 இருக்கு, புவனேஸ்வர்ல இருக்கு, கட்டக்ல இருக்கு.
300 hospitals. It is uniformly spread around your area.
So I won't say uniformly spread because to be honest நம்ம டெல்லில இல்ல, NCR இல்ல, UP அத நான் சொல்றேன். அங்க என்டர் பண்ணோம். So problem என்ன இருக்கு? காசு பத்தி இல்ல. மேன் பவர் ப்ராப்ளம் இருக்குங்க. Where is the bottleneck இங்க? நம்ம கிட்ட மேன் பவர் இருக்கு. Suppose you are journalist, you also know you can open, let's say, bureaus in 100 places. If you also having less manpower, so your resident will say you go here, 10 places today itself. You will tell him inna ba 10 places na eppadi pono. He will say yes baba, ipo manpower illa namakkitta inga. Same problem we are facing across the board. Not only Tamil Nadu sir, across India, because see the heat is not going to be different in Madurai or Tirunelveli or Chennai. It's all going to be the same heat. Even food habits are the same. By and large, we are all the same. We all eat sweets. I love sweets. You also eat sweets. So it's not Tamil Nadu or Madurai. Across the board, generally it is there. We have to accept it. Idea is to eradicate that blindness, because suppose yaar pore muttu porudha, they will leave it behind, and it's not money. I see rich people leaving cataract behind because they don't understand. Suppose நம்ம அப்படி விடுறது, it will burst. It can burst in the eye. Simple. பொறே மாங்காய் மாதிரி இருக்கு, நீங்க மாங்காய் அப்படி விடுறது, it will burst. Simple like that. I see patients who are mature cataract left untreated and which can burst.